Calling the 1 p.m. Health and Human Services calendar. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, March 12th at 1 p.m. in room 225. For those on Zoom, your audio will be muted and video disabled until shortly before it is your turn to testify. Each testifier will have 1 minute to testify, and I have read all of the testimonies, okay? But there will be time for questions, so keep it within that 1 minute. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you again that I have read and reviewed your testimony. I encourage you to use your time, because it's only 1 minute, to either add additional comments or stand on your written testimony. So first up, HB 72 relating to pharmacy. We have, excuse me, Ray Matsumoto, University of Hawaii System, in support. James Kozilski, Board of Pharmacy, in support. Board of Pharmacy, okay.
Hello, Chair. I'm here on Zoom. So just want to say
Okay.
we're here to stand on our written testimony. Thank you.
Okay, thank you very much. Tiffany Ajima, Walgreens Company, in support. Tiffany?
In support, thank you.
Thank you. Corey Sanders, Hawaii Pharmacists Association, in support.
Stand in support.
Thank you. Okay. Forrest Batts, in support. Lara Gomes, in support. Ronald Taniguchi, MBA, in support. Dylan Soliday, in support. Faith Hicks, in support. Anybody else wishing to testify on HB 72? Okay, seeing none, we're going to move on. And I don't have any questions. HB 237, relating to peer support programs. First up, we have Department of Health in support. Department of Health, please
We stand on
proceed.
our testimony in support. Thank you.
Thank you very much. Director Yamane, DHS in support. Executive Office on Early Learning, providing comments. Yukio. Yukiko. Okay, thank you. Sherilyn Shinoki, Family Hui Hawaii, in support. Sherilyn?
Stand in support of my testimony, but also really want to emphasize that nobody really understands it like a peer, and it's a wise investment in our community.
Thank you very much. Next, Justina Acevedo Cross, Hawaii Community Foundation, in support. Matthew Lauren, Matthew of Lauren Group LLC, in support. Adrian Miller, in support. Jared Ellis, Commit to Keiki, in support. Mike Wen of Aloha Care, in support. Okay, thank you. Kevin Shinoki, Guardian Capital Management Hawaii, in support. Kiana Kawave, in support. Kiana, are you present on Zoom?
Not present on Zoom, Chair.
Okay, James Labrie, in support. James, you want to come up? Okay,
Good afternoon, Chair, committee members. I'm James Labrie. I'm standing on my written testimony, and I'm gonna explain a little bit about why. It's because I'm a former prosecutor and I'm a grief and trauma facilitator, and not very many people with disabilities or family members know that there are people out there like us that needs peer-to-peer mentoring support group, because we may not feel comfortable on talking to our caregivers because of personal reasons. So I highly encourage this bill to be passed for the state to hire or find funding for people to be comfortable to talk to someone that can help individuals with peer-to-peer and mentoring support. Thank you.
Thank you very much, James. Thank you. Next, we have Leilani Novak in support. Come,
Thank you so much for the opportunity to speak in support today.
if you're not, if you're not going to stand in support, you got to speak on the mic. Okay.
Hello again.
Okay, so identify yourself.
My name is Leilani Novak, speaking in strong support today. I stand with my written testimony, but also as someone who is both very excited and terrified by the prospect of starting a family. The hope that peer-to-peer support programs gives me for my future and the future of my keiki is something that I really want to emphasize today, and that the hope and the support that it gives families in times of isolation and strong stress. And thank you so much.
Okay, thank you very much. Calais Flores in support. Calais, are you present on Zoom?
Yes, I'm present on Zoom.
Please proceed.
Good morning, Chair, Vice Chair, members of the committee. My name is Kaylee Flores, and I'm here to express my support for House Bill 237. Parenting is one of the most rewarding but challenging jobs out there, and it's only more difficult for families that have financial problems, mental illness, or other obstacles. These difficulties can isolate parents from their loved ones or other support systems. This process can create burnout for parents and in the long term have negative effects on their health and their children's health. Without any assistance, some parents are likely to struggle offering their children the necessary care, which can lead to endangering the child for possible abuse and neglect. So the need for peer-to-peer support is essential. These programs can provide safety to parents in the sense that they are able to identify and receive help. These kinds of programs, parents can learn coping strategies, get empowered, and obtain valuable sources of information and receive support for parents and well-beings. Because of these factors, I support House Bill 237. This bill is an important step for families and children in the long run. Thank you.
Okay, thank you very much. Calais, are you testifying from Hilo?
Am I what?
Are you testifying from Hilo?
No, ma'am. I'm at UH in Manoa.
Okay. Okay, no, your background looks like a state building in Hilo, that's why. Okay, thank you very much. Next, we have Adrian Miller in support. Shaleigh Galarza in support. Will Tanaka in support. Joanne Farnsworth in support. Ellen Avai in support. Dr. Sharon Tisa in support. Jessica Flaherty in support. Jasmine Anderson in support. Rosalind Mahashin in support. Lilia Glauberman in support, Sade Kahua in support, Ann Davis in support, Wayna Ogata in support, Carrie Barringer in support, Karen Worthington in support, and Lori Tochiki in support. Anybody else wishing to testify on HB 237? Seeing none, and I have no questions. Moving on. HB 250 relating to health. It's the prior authorization bill. First up, we have Deputy AG providing comments. Deputy AG?
Yeah, we sat in our written testimony providing comments. Thank you.
Thank you very much. And I see Jack Lewin for State Health Planning Developmental Agency in support. Come on up.
Aloha, Chair. Sacramento Targ. Jack Lewin here from SHPTA. This bill's gone through a number of changes, and what I'm recommending here is one that is a bill that has been modified to take the best aspects of 250 HD1 and HD2 and bring them together so the two elements, the reporting of prior authorization practices to SHPTA, so we can see transparently what's going on, and then a working group without any binding regulatory requirements to try to come to consensus on the standards to allow us to automate prior authorization by agreeing together. We think this version of the bill, actually we put a draft version of how we'd like the bill to be reworded to include the good aspects of the other two bills, but to remove two clauses in there that are inconsistent with SHPTA's statutory definitions. And finally, just because we think those would require additional resources for the regulatory side of that, which we didn't request in the bill. So
Thank you
we
very
respect
much.
your determination. Thank you very much.
Thank you very much. Next, we have Derek Mizuno for EUTF providing comments. Next, we have Rachel Wilkinson, Hawaii Association of Health Plans providing comments. Rachel? Thank you very much. Tonia Neal of PCMA in opposition. Tonia?
Thank you, Chair. My name is Tanya Neal. I'm with the Pharmaceutical Care Management Association. So we've offered an amendment by our comments that would remove the pharmaceutical elements out of this. We think that it's not necessarily the intent is to include all of pharmacy. We have prior auth processes for pharmacy currently. So this would be adding an added layer of duplication. And we also have automated services and electronic approvals for prior auth. And so again, by the state requiring a second level, that's going to actually slow down the ability for us to get those prior auths quicker to the patients when they need them, especially in the times of emergency situations. So we would ask that the committee amend the bill and pull out lines 15 and 16 to remove the pharmacy portion at this time, and then obviously continue on with the medical side of it. And then we can talk about the pharmacy side and get more information to everybody to recognize the unintended consequences that are currently in this bill.
Thank you very much.
Thank you.
So Tonia Neal in opposition, and we have Don Kurisu providing comments from HMSA.
Aloha, Chair Don Carisi. On behalf of HMSA, I just wanted to highlight that we have some concerns with the language on page 4, line 14 to page 7, line 2, and we request that that language be removed, but it's also consistent with the draft that SHPTA has proposed to the committee. And so we just want to thank everybody for working really hard on this bill to make it workable and help to push prior authorization forward. So just want to request your consideration of the removal of that language. Thank you.
Okay, thank you very much. Next, we have Jonathan Ching of Kaiser Permanente providing comments. Jonathan Ching, please proceed.
Aloha, Chair. San Buenaventura, Jonathan Ching for Kaiser Permanente. We've offered comments and have suggested amendments. I will note that we understand that, there's a lot of stakeholders that have interest in this bill, and, just wholeheartedly, we understand that, prior authorization shouldn't inhibit the timely access to clinically appropriate care. And that, with that in mind, we've offered some amendments that we believe are still consistent with the intent of this bill, but will also, I think, as other stakeholders have mentioned, really focus on ensuring that there's alignment with any of the federal developments with related to prior authorization, just so it would not make any state reporting requirements and or timelines be inconsistent or duplicative of what is also required of health plans with the federal government. We're available for any questions, and thank you for the consideration, Chair.
Okay, thank you very much. Next, we have Kapona Chong Hansen of Ahahui Ona Kauka Association of Native Hawaiian Physicians in support. Eric Abe, Hawaii Primary Care Association in support. Elizabeth Ignacio of Hawaii Medical Association in support. Dr. Ignacio, are you present? Please proceed.
Aloha and good afternoon, Chair San Buenaventura and Committee. Dr. Elizabeth Ignacio, Hawaii Medical Association. We do stand on our written testimony with 2 amendments for your consideration that we had conferred and reviewed with other stakeholders. We want to add the comment that we're deeply grateful for the engagement and aloha of the stakeholders and advocates, including in particular HMSA and SHPTA. We're available for questions, Chair. Thank you.
Okay, thank you very much. Next, we have Dr. Scott Goskritz in support. Gerald Garcia, Dr. Garcia in support for Hawaii Medical Association. Dr. Garcia, are you present on Zoom? Please proceed.
Aloha. Can you guys hear me?
Yes.
Dr. Garcia here. I'd like to thank you, Chair Bonaventura, and the honorable committee members. It's high time that something is done about prior auth for the sake of our patients, for the sake of the doctors taking care of these patients. This is a step in the right direction. It's not asking for too much. We stand by our testimony. Thank you so much once again, and we're here for questions. Again, Dr. Jerry Garcia with Hawaii Medical Association.
Thank you very much. Next, we have James Levy in support.
Good afternoon, Chair, committee members, James Labrie. I stand in full support of HB 250 because originally on December 19, I was supposed to have a phenol injection for my right hip due to right hip pain. But if I did not call the doctor to ask how come I didn't get a reminder call to see how come they didn't give me prior pre-procedure instructions, they wouldn't have called me to let me know that they would have to cancel me because they needed to do a more invasive procedure for another patient, which I understood, but I would prefer that they would actually give us a call, especially because I had to fast.
Yeah.
And that's very difficult given my condition and because I take Hanimen as well. And I highly encourage, as you pass this bill, that we put in the bill for a timeline of 48 hours, because right now, insurance says that there's 2 weeks to pass all prior authorizations, but for someone like me, it's very difficult to schedule appointments. But thank you for allowing me to take this time to testify on this bill, and I'm happy to take any questions.
Thank you very much, James. Thank you very much, James. Next, we have Kelly Withy in support. Kelly, are you present?
I am, and I
Please
stand
proceed.
on testimony.
You'll stand your testimony. Thank you very much. Next,
Thank
we have Shayna Metch in support, Alan Novak in support, Colleen Inoue in support, Dr. Taniguchi in support, Thomas Weiner in support, Alistair Byros in support, Ricardo Molero Bravo in support, Maya Maxim in support. Anybody else wishing to testify on HB 250? Come on up, Mike Wynn.
Good afternoon, Chair, Vice Chair. Mike Nguyen, Director of Public Policy for Care. Apologies for the late testimony. I did submit it on the portal, but it's just not in the reflected testimony. We do appreciate the concerns. We are committed to access to care, timely access to care, and we support the intent of the measure, but we do have concerns with the timelines proposed in Section 2 of the bill. And we're concerned that there are unintended consequences that would be resulting from such such provisions. And we just ask that the timelines be removed, noting the CMS timelines to take effect in January 2026.
Okay, thank you very much.
Thank you.
Okay, anybody else wishing to testify on HB 250? Members, any questions? So I do. Dr. Lewin, come on up. So you came up with an entire new SD1, which I did not expect. Specifically regarding the working group, is that any different from your bill in SB, which we passed before crossover in SB, excuse me. Yeah, as part of the governor's package. Is there any difference in that working group?
The working group wasn't in the original governor's package. It was, it's in 1449 SB.
1449.
Yeah, it was, hopefully we asked that it be added.
So is the working group in Senate Bill 1449 any different from the working group you proposed on your SD1?
It should be the same.
Should be the same?
Should be exactly the same.
Okay. Okay, thank you very much.
You're welcome.
Any other questions? Okay, seeing none, moving on. HB 303. relating to healthcare preceptors. First up, Department of Health and Support.
Yes, the department stands on its written testimony.
Okay, thank you very much. Next is Department of Taxation providing comments.
Hello, Chair, Vice Chair, Garrett for Frugal Tax. We stand on our testimony.
Thank you very much. Kelly Whitty, University of Hawaii System in support. Kelly, are you still present on Zoom? Please proceed.
I am, and I will stand on our testimony, and I can give any numbers that you have about questions that you have regarding numbers from past years.
Okay, thank you very much. Next, we have Laura Reichart, Hawaii State Center for Nursing and Support. JC Mikulanek, Queens Health Systems. In support. Paige Heckathorn Choi of Healthcare Association of Hawaii in support. Paige, are you present? Please proceed.
I am, thank you. We'll stand on our support of this measure. Thank you, Chair.
Okay, thank you very much. Next, we have Leocadia Conlon of Hawaii Academy of PAs in support.
Thank you, Chair. The Hawaii Academy of PA stands on this testimony in support.
Thank you very much. Tom Yamachika, Tax Foundation of Hawaii, providing comments.
Not present on Zoom, Chair.
Michael Robinson, Hawaii Pacific Health in support. Jonathan Ching, are you present on Zoom? Kaiser Permanente in support.
Still present, Chair. Jonathan Ching for Kaiser Permanente will stand on our written testimony in support of this measure. Thank you.
Okay, thank you very much. Next, we have Eric Abe, Hawaii Primary Care Association in support. Dr. Ignacio, Hawaii Medical Association in support. Edward Chu, Hawaii Health Systems Corporation in support. Linda Bechinor, Hawaii American Nurses Association in support. Corey Sanders, Hawaii Pharmacists Association in support. Please proceed.
Good afternoon, Chair, Vice Chair, members of the committee. Corey Sanders, Executive Director of the Hawaii Pharmacists Association. Stand in support. I just want to emphasize the comment that we provided that all other provider residency programs have their nationally accredited program outlined in the bill, and we're asking for the same, that pharmacists have the American Society of Health System Pharmacists added to the bill.
Okay, thank you very much. Tracy Ann Lee in support. Nicholas De La Rosa Tabilisma in support. Anybody else wishing to testify on HB 303?
Chair.
Mike Nguyen, please identify yourself.
Mike Nguyen with Aloha Care. Apologies, we submitted testimony and support late as well. Thank you.
Okay, thank you very much. Okay, next we have anybody else wishing to testify on HB 303? Members, any questions? Okay, seeing none, moving on. HB 341. Not yet, I'll call it then. Okay, HB 341, relating to issuance of SPURBs to assist Hawaii Island Community Health Association. And I see Hawaii Community Health Association wanting to testify, but let me read the witnesses. Okay. Department of Budget and Finance providing comments. Richard Taffy, now it's your turn. Hawaii Island Community Health Center in support.
I appreciate the opportunity, and I just stand in support of our written testimony. Help us move forward and answer any questions you might have.
Thank you very much, Richard. Eric Abe, Hawaii Primary Care Association in support. Mike Nguyen, Aloha Care. Okay, thank you very much. Anybody else wishing to testify on HB 341? Okay, members, any questions? Okay, next up, HB 692. I see Lieutenant Governor, but let me read my witnesses. Relating to preschool open doors. Preschool open doors. Hold on. Lieutenant Governor, you're up.
Thank you. Thank you, Chair and committee members. Strong support, and we'll be able to do that.
Thank you very much. Director Yamane, Department of Human Services in support. Director, you're present on Zoom. Oh, you're present in person. Thank you. Yuki Arikawa Cross, I see you back there. Executive Office of Early Learning in support.
Yes, we stand on our written testimony in support.
Thank you. Elaine Yamashita, Early Learning Board in support. Elaine, please proceed.
Okay. Aloha from Maui. The board stands on its testimony of support. Mahalo.
Okay, thank you very much. Next, we have Hope Bennett, Honolulu County Committee on the Status of Women in support. Jen Kagiwara in support. Jordana Ferreira, City and County of Honolulu in support. Jordana, you present? No. Wayale Ale Arroyo for Kamehameha Schools in support. Jeffrey Matatsugo of IUPAT District Council 50 in support. Jonette Jordan Piper in support. Deborah Bond Upson of Parents for Public Schools of Hawaii in support. Thank you very much. Jared Ellis, Early Childhood Action Strategy in support. Hawaii Children Action Network speaks. Chevelle Davis in support. Chevelle? Okay, thank you. Hawaii State Teachers Association in support. Osa Tui. Hui for Excellence of Education in support. Thank you. Huakalehua Early Learning Consortium in support. Parents and Children Together in support. AAUW in support. Ka'ohana Onapua in support. Family Hui Hawaii in support. Thank you. Kupuna Caucus of the Democratic Party of Hawaii in support. Hawaii State Coalition Against Domestic Violence in support. Okay. And then we have Joelle Edwards. Are you present on Zoom in support? Joelle?
I'd like to add to my testimony. My name is Joelle Edwards, a small business owner, chair of the Kauai Democratic Party, and a community advocate here in Wainiha. I strongly support HB 692. I've watched firsthand the struggles our families encounter due to lack of safe, reliable, and affordable childcare. Hawaii is a literal childcare desert with less than one space for every 4 children. And currently, we're under the threat of our only preschool in Hanalei closing after 45 years due to the land and the building being up for sale. The cost of living on Kauai exceeds the state averages, so any help to get parents back to work through affordable, accessible childcare will improve the lives of community members, families, businesses, and the economy at large. I appreciate this opportunity to have some stability for our working families and a meaningful public-private partnership that shows mutual benefit. Thank you for the opportunity to speak today and to submit testimony. Mahalo.
Thank you very much. And then we have 73 other individuals, all in support. Anybody else wishing to testify on HB 692? Members, any questions? I do. Lieutenant Governor, come on up. So HCAN Speaks and AAUW want to amend this bill to add in family childcare providers, I believe. Do you have any objections to that?
For now, what we're trying to do with this bill is expand the preschool open doors for the current licensed facility. I think to expand it may not completely fit into what we're trying to do, because this is expanding it to 2-year-olds and also deal with the accreditation efforts. And so for now, I think it should be separate.
Okay, thank you very much. Anybody else have any other questions? Okay.
DHS?
Go ahead, Senator Hashimoto. DHS, come on up. You're standing in for Director Yamane.
So thanks for being here. I just wanted to clarify, I think this bill is very important, and I think it's one step in the right direction. But what is DHS doing to help with the certification of new preschools, or early childhood centers getting their certification? Because my understanding from my conversations with providers is that it is super hard to get certification right now. So even if we expand the bill or the use, it doesn't matter at a certain point, because we just don't have enough providers who are easily getting the licensures that they need. So are you guys working on that aspect? Because yes, we can do this bill, but then if we're not getting to the root cause of the problem of why we're not able to enroll more people, then it's kind of moot, right?
Thank you for that question, Senator. Really, I do believe our licensing staff, they're working hard with the childcare providers. I can take that back to our childcare regulation administrator and see, but I do honestly think each of our licensing units in our counties do work with our providers.
So what, do we know what the expansion has been of new providers over the last couple of years?
Of new providers, I'd probably have to get back to you on that one.
Okay, because I think I recently talked to a provider on Maui who's just been, he was telling me all the hoops that he had to jump through
Is
to
that right?
open up a preschool. And he's like, at a certain point, it's too hard. So people are giving up, or they're just not even looking at it, right? And then the economics of it. So I think we got to look at the whole spectrum. I think that has continually been the conversation about, all the levers that we need to pull to make the expansion, relevant. I think EOEL is a part of that conversation with make sure that they're not poaching from this program either. I think I've previously made that a point to bring that up. So hopefully you guys can get to the bottom of all that, because there needs to be a more comprehensive look of understanding what everybody is doing for us to make this work.
Yes, we will work with all of our providers.
No, I want that information though, because that's a good question. Like how many people have been
New
licensed, right? Thank you, Chair.
Okay, thank you very much. So I have a follow-up question. Lieutenant Governor. So I remember working on the whole certification requirement, and I was hoping it was in this bill, but probably was in another bill. Are you working on the problems regarding certification?
The problems with certification is a separate issue. In this situation, what we're dealing with is the current DHS licensed childcare facility. So certification is definitely something that you have to address, because it is the whole spectrum, as Senator Hashimoto recognized. Under the Ready Keiki initiative, we just got the recent enrollment or application numbers for EOEL. And the unfortunate reality, it's very successful, because under EOEL, there's about 1,700 seats. We just got the new numbers, it's about 3,400 applications that came in. So in as much as we're all trying really hard to add seats, there is a huge demand out there. And the bills like this and all the efforts that people are putting together, it's raising that awareness to a parent of a 2-year-old, 3-year-old, 4-year-old, saying there are different opportunities, but we have to do a holistic approach in increasing public seats, supporting private seats, ensuring that they're not cannibalizing each other, and then figuring out ways to expand on all levels.
Okay, thank you very much. Okay, any other questions? Okay, seeing none, moving on. HB 700 relating to cognitive assessments. First up, we have Department of Health in support.
The department stands on its written testimony.
Thank you. Carolyn Kadirao, Executive Office on Aging, providing comments.
Good afternoon, Senator, Vice Chair, and Senator Hashimoto. Thank you so much for hearing this bill. We're in strong support of the intent, and we're offering some comments. I'd like to thank our partners, both SHPTA and the Alzheimer's Association, for coming together and finding out a way that we could make this work as far as the data collection, and we have some ideas. That's why we made some amendments, are recommending some amendments and changes so that we have flexibility to continue on the dialogue. I also want to stress that it's important that we use a validated tool and also strip the age of 65 and older, because we know that individuals with disabilities also are at risk for Alzheimer's disease and related dementia. So we want to make sure that we can get early detection for all. And I'm available for any questions.
Thank you very much. Okay, next we have Daintree Bartolodis of Hawaii State Council on Developmental Disabilities in support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Samir Gorham, and I am an intern at the Hawaii State Council on Disabilities here on behalf of my boss, Daintree. We stand in support of this measure because adults with Down syndrome and traumatic brain injuries, as said before, are significantly more likely to get Alzheimer's or dementia, often showing symptoms in their 40s and their 50s. For this reason, we respectfully request that the age 65 be removed. Thank you.
Okay, thank you very much. Next, we have Dr. Lewins, State SHPTA, in support. So come on up.
San Buenaventura, Vice Chair Aquino, and members. We strongly support the intent of this bill as well, and SHPTA would really like to work on the data reporting part of the bill, this information reporting. We believe that because a particular brand of electronic health record has almost captured the entire Hawaii market, it's going to be approaching 80% use, that we could actually administer the test in that electronic health record, collate the results, and report back. That isn't something that will happen immediately, but it could certainly happen in the immediate future if we work on that together to make that reporting easier. So thank you very much.
Okay, thank you very much. Next up, Hawaii Parkinson Association in support. Paige Choi, Healthcare Association of Hawaii, providing comments. Please proceed.
Good afternoon, Chair, Vice Chair, members of the committee. We'll stand on our comments. I do want to emphasize in our comments that we believe having this not be mandatory, especially in terms of the reporting and maintaining it as a pilot so that we can continue to work with the stakeholders is something that our members are very supportive of. So thank you very much for allowing us to comment.
Thank you very much. Louis Urchik, Hawaii Disability Rights Center in support. Eric Abe, Hawaii Primary Care Association in support. Hawaii Public Health Association, Holly Kessler in support. Hawaii Psychological Association, Alex Lichten in support. Joanne Kealoha, Hawaii Alliance for Retired Americans in support. Kobe Chok, come on up. Alzheimer's Association in support.
Thank you, Chair San Buenaventura, Vice Chair Aquino, and Senator Hashimoto. My name is Kobe Chalk with the Alzheimer's Association, in strong support of this with amendments that we have provided in our written testimony. We just want to take this opportunity to highlight our key amendment. In the first hearing, we supported a pilot program for the data component of the bill. However, our support for the pilot was intended solely for the data and not for the entire bill, which is what is in this HD1. The core and initial intent of this legislation is the requirement for a simple and brief cognitive assessment tool be used during the annual wellness visit. And a proposed amendment would codify this in statute. It's important to note that we're not expanding the scope of the annual wellness visit as it's already included. We're just saying that it needs to be a validated tool because with the new treatments available, it requires early diagnosis that we're missing so many people who could be getting better treatment and care. It's a disease that's invisible until often it's too late and progresses too far. We respectfully ask for your support of our amendment to require the use of the validated cognitive assessment tool in statute, and we're available for any questions. Thank you for this opportunity.
Thank you very much. Next, we have Kathleen Wyatt in support. Are you present, Kathleen? Please proceed.
Aloha, and thank you for letting me testify today, Senator and committee. I testified in writing as well, but I wanted to add a few comments. As an adult daycare operator, I deal with the families so much. And if they had, a lot of them are so frustrated because if they had warning, they could be prepared for the caregiving duties they're going to face with somebody that has dementia. If they're, like the old saying is to be forewarned is forearmed. So if they were able to get early diagnosis, I mean, if they have this annual assessment, they could have earlier access to interventions, to prevention, and the more they can do with their families ahead of time, be prepared for what's going to happen, what they need to have ready when the time comes when their folks decline, is so important that they know ahead of time. Thank you so much for letting me testify.
Thank you. Okay, next up we have Calvin Hara in support. Calvin, please proceed.
Aloha, Chair, Vice Chair Aquino, and Senator Hashimoto. My name is Calvin Hara. My background career has been in 30 years in senior care in California and Hawaii, as well as a caregiver for my mom and my uncle. I support the required use of a validated cognitive assessment tool, as mentioned about the annual wellness visit, and I'd like to highlight that the Alzheimer's Association's original draft and the current proposed language provides providers flexibility, discretion in selecting the cognitive assessment tool. To briefly state the validated tests, I have two examples here, the mini-cog and the 88. Both tests are short, take only a few minutes to administer. and can be conducted by various providers like doctors, APRNs, RNs, PAs, social workers, other trained professionals. The tests are free, straightforward, has instructions. It makes it easier for the providers not using any tests right now to kind of put that into their practice. With the new disease-modifying treatments.
Okay, thank you
Yep.
very much.
Rare. Thank you.
Thank you. Next, we have Ellen Owai providing comments, Chuck Taylor in support. Kristen Hartley, are you present on Zoom in support? Kristen? Not present on Zoom? Kristen Hartley, are you?
I am. I'm so sorry.
Please
My
proceed.
camera seems to be failing. Can you hear me?
Yes, please proceed.
Hi, good afternoon, Chair, members of the committee. I just wanted to say I stand on my testimony that I've submitted in writing, but just to piggyback on what Kathleen Wyatt said, that the use and requirement of a validated tool really will significantly help in both the intervention and prevention of this horrible thief of a disease. Having watched my father go through it without the benefit of a standardized tool, knowing that he could have been a part of a larger data collection is it's bothersome, and it feels like something we can do something about. Thank you for allowing me the opportunity to speak today. Mahalo.
Okay, thank you very much. Next, we have Rick Tabor in support, Bixby Ho in support, Barbara Black in support. Barbara, are you present on Zoom? Barbara? Okay, we're gonna move on to the next person. Marshall Mower in support, Joe Hittner in support, Jerry Perone in support, Leela Mower in support, Valerie Hasegawa Takahashi in support, Peter Western Black. Peter, are you present on Zoom? Okay. Barbara, is that you?
Yes, I'm here too.
Okay, you have 1 minute. Go ahead.
Thank you. Chair, Vice Chair, members of the committee, I'm a resident of Ninoli and a caregiver for my husband, Peter.
Please identify yourself.
Barbara Black, sorry.
Thank you.
Peter, my husband, had a relatively early diagnosis, which helped us plan and figure out how we would manage this disease as it progressed. And I also have done a lot of workshops and online studies about resources for caregivers. And that's been very helpful as we've moved through the progression of this disease. Caregiving is complex and difficult, and the ability to adjust and learn as early as possible has helped me immensely. I strongly support this bill, including the amendments proposed by the Alzheimer's Association. If more people had the benefit of an early diagnosis, it would be really, really good. And I hope money is made available to support this endeavor.
Thank you very much, Barbara.
Thank you.
Next person is Peter Weston Black. Are you present, Peter, on Zoom?
He's present, Chair, but seems to be having technical difficulties.
Okay, so while we are awaiting Preston Peter being able to turn on his camera, is anyone else wishing to testify on cognitive assessments, HB 700? Okay, please proceed, Peter. You need to unmute yourself, Peter. IT, can you unmute him?
He seems not to be connected to his microphone, Chair.
Okay. So Barbara, since you're there, he cannot use your microphone? Oh, they have two separate computers. Okay. So Barbara, can you turn on your monitor and your microphone so that Peter can testify? Okay, please proceed, Peter.
You can see me now.
Yes, we can hear
Thank
you
you.
now. We
All
can
right.
see you now.
So sorry about the follow-up.
No problem. Go
Look,
ahead.
I'm glad to be able to do this. I really believe in what's in that bill. I am 82 years old. I'm a retired professor. So, words are my world, and that's hard to cram into a minute what I have to say, but it's a great bill. And my personal experience is testimony to that. I got this diagnosis 10 years ago. And now I'm able to be on Leqembi, the drug that is one of the drugs that are very recently out that don't cure Alzheimer's, but postpone the really crappy symptoms. So here's why I support the bill. Getting that diagnosis was a gift. It was a blessing. It was a gift that has kept on giving ever since, 10 years. And
Okay, thank you very much, Peter.
All right.
Thank you very much. And yes, you are a testament as to why we need to pass this bill. So thank you very much for being there. Anybody else wishing to testify on HB 700? Members, any questions? Okay, moving on. HB 705, relating to Executive Office on Aging. First up, we have, excuse me. Carolyn Cadirao, Office of Aging and Support.
Thank you, Chair and members of the committee. Carolyn Cadirao, Executive Office on Aging. We stand in strong support of this measure. You have our testimony. You know the three reasons how it's going to help individuals, MedQuest, and also the Executive Office on Aging. The work being done right now is all being done with federal funds. This would support us to have a generally funded position that we can also support getting MAC claiming, if MAC claiming is still available from the federal government, would help to offset some of the costs for this project. This is access. It will help us to get access to those that don't have the normal means of applying for these low subsidy programs, and we will help them with the application process and wraparound services. I'm available for any questions. Thank you.
Thank you very much. Next, Dainty Bartolodis, Hawaii State Council on Developmental Disabilities and Support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Samir Gorham. I'm an intern on behalf of Daintree with the Hawaii State Council on Developmental Disabilities. We stand in strong support of this measure, mainly because it supports individuals with disabilities under the age of 65 in our communities. So thank you.
Thank you very much. Dr. Luan of SHPTA in support.
Aloha, Senator and members. We stand on our testimony.
Thank you very much. AARP, Audrey Suga Nakagawa in support. Bronson Silva, Democratic Party of Hawaii in support. Linda Dorset in support. Barbara Service in support. Anybody else wishing to testify on HB 705? Members, any questions? Okay, moving on. HB 713, relating to rate study for home health services. First up, we have, DHS providing comments. DHS, no?
Aloha, Chair. Judy Moore Peterson on behalf of Director Yamane and DHS. We stand on our written testimony, offering comments and appreciating the intent. Available for any questions. Thank you.
Thank you. Next, we have Paige Choi, Healthcare Association of Hawaii and support. Please proceed.
Thank you, Chair. We are in very strong support of this measure. Our home health agencies provide more complex care. So unlike personal care services, which this committee has heard, bills to increase the funding for, home health services are more geared towards helping people with therapies, PT, OT, IV, drugs, and then of course, wound care. Really helps to keep people out of higher cost settings of care, such as the hospital or nursing homes. Our home health agencies have reported that they're losing more than $1,000 per patient when they are serving Medicaid individuals. We are hoping that this rate study will help us get our reimbursements up to the cost of care and increase the proportion of Medicaid residents served by home health agencies. We did also find that the proportion of individuals on Medicaid being treated went from 25 to 16 over the last 5 years, 25% to 16%. And so we think this is an important bill to start to help address that. Thank you.
Thank you very much. Barbara, service and support. Anybody else wishing to testify on HB 713? Members, any questions? Seeing none, moving on. Next up, we have relating to crisis services, HB 1462. First up, we have Dr. Lewin in support.
Chair, Vice Chair, members, SHIP stands on its written testimony and strong support.
Okay, next up, we have Kat Brady in support. Please come on up.
Good afternoon, Chair and committee members. Kat Brady in strong support, testifying for Community Alliance on Prisons. This morning, I received a really disturbing phone call from someone who attended the Mental Health Commission. I don't know the exact name, but they said the February meeting was rocking. And I think that we support behavioral health and crisis services, but we also were told that the Evalate DHCC, there's hardly anybody there.
Okay.
So that's a problem.
Yeah, thank you very much. Next, we have Department of Law Enforcement, Mike Lambert, Captain Lambert in support. Hawaii State Department of Health in support. I see Dr. Okay, Marian Suji.
Good afternoon. We do support this bill. We apologize for a late submission, but we wanted to add some language that provided us with a little more flexibility for the operation.
Okay, thank you very much. Next, we have Alan Johnson of HSAC in support. Cassandra Manasio Morse in support. Cassandra, you're present on Zoom. Okay, moving on. Austin Sacido in support. Maya Gunther in support. Veronica Moore in support. Raylan Reyno Yeomans in opposition. Are you present on Zoom, Raylan?
Not present on Zoom, Chair.
Ellen Awai in support. Anybody else wishing to testify on HB 1462? Come on up, Ian Ross.
Thank you very much, Senator.
Identify yourself, though.
Aloha, Senator, Chair, Vice Chair. My name is Ian Ross. I'm the Public Affairs Director with the Waianae Coast Comprehensive Health Center. We submitted a written testimony, and I just wanted to add a quick story to that. On Tuesday, February 25th, a team from our behavioral health department led by Lena Kanana, our Chief Community Health Services Officer, went and visited the Care Hawaii Behavioral Crisis Center in Ivalai. We found that the services being offered there were very impressive to our group. Our team really helps the leeward side in a lot of ways in attempting of comprehensive care, and we think this would be a great addition. The original draft, of course, called for it specifically in the zip code, but we feel that more of these types of facilities could only help with the types of operational issues we're seeing in providing the right types of services to this population. Thank you very much.
Okay, thank you very much. Next, anybody else wishing to testify on HB 1462? Members, any questions? Okay, seeing none, moving on. For HB 1477 relating to social services, first up, Department of Human Services in support. Please proceed.
Good afternoon, Chair, Vice Chair, and Committee. Lisa Amador from Department of Human Services on behalf of Director Yamane. The department stands on our written testimony supporting the intent of this bill and respectfully requesting amendments to clarify the purpose. I'm available for questions.
Thank you very much. Next, we have Dainty Bartolidis, Hawaii State Council on Developmental Disabilities in support.
Good afternoon, Chair, Vice Chair. We are in strong support of this bill, and we ask that all questions be referred to the HHS.
Thank you very much. Rachel Lewis, Easter Silks Hawaii in support. Anybody else wishing to testify on HB 1477? Members, any questions? Seeing none, are we ready for decision making? Do you folks have my decision making notes? Okay, so first up, for HB 72, relating to pharmacy. Chair's recommendation is to pass this with Board of Pharmacy's recommended amendments and technical non-substantive amendments need for clarity, consistency, and a defective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, Chair votes aye, Vice Chair votes aye. Senator Hashimoto. Aye. Senator Keokalole is excused. Senator Favela is excused. Recommendation is adopted, Chair.
Thank you. For HB 237, Chair's recommendation is to pass this just with a different defective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 250, Chair's recommendation on this is to pass this with amendments. We're going to remove the healthcare definition pursuant to the Department of Attorney General's concerns. And we're also going to accept Kaiser's amendments, which basically puts in SB 1449 in lieu of the working group. And we're going to note that the reason although we are super sympathetic to the physicians who I'm sure are watching this YouTube, the turnaround times is super problematic because of the EUTF amendments. And I'd like to note that we have a law that basically says that we cannot pass a bill that increases the unfunded liabilities. And if you look at the EUTF testimony, the unfunded liabilities with the short time frames is going to increase it substantially. So hopefully the working group will come up with proposed recommendations so that we can have reasonable turnaround times. And but other than that, any other comments, questions, or concerns? At least the physicians know why the committee is making the proposed amendments. Okay, any comments, questions, concerns? Basically to pass with amendments. Chair votes aye.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, preceptors, HB 303. Chair's recommendation is to pass this with technical non-substantive amendments, and we're also going to pass it with a different effective date of December 31, 2050. We note that the effective taxable year is still December 31, 2025, pursuant to the DOE taxes recommendation. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 341, SPURG, Chair's recommendation is to pass this with technical non-substantive amendments. We're going to note that it's still a blank SPURG amount, but we're going to change it, the defective date, into an effective date of July 1, 2026. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for HB 692, Chair's recommendation is to pass this only with technical non-substantive amendments, noting the Lieutenant Governor's position. And we are going to pass this with an effective date of July 1, 2026. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 700, Chair's recommendation is to pass this with the Council of Developmental Disabilities proposed amendments, which basically removes the age and puts in also individuals with propensity for Alzheimer's, and also technical non-substantive amendments as recommended by SMA. I am not at this time going to accept Alzheimer's request of putting it in as part of the wellness exam because that may open us up to a requirement of a sunrise analysis. Anything we add in that is not already in as part of the requirements may poison pill this bill. So because we have a pilot, let's see what happens. And if that says that we don't need a sunrise analysis, then we can continue on with that. Okay, so basically to pass with amendments, and we're also going to put in an effective date of July 1, 2026. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 705, Chair's recommendation is to pass this with Office of Aging's proposed amendments and a different defective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for HB 713, Chair's recommendation is to pass this with a different defective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
I'd also like to note that it has nothing to do with the decision, that the committee report, we're gonna put in DHS proposed amount of $500,000 in the committee report, with 50% of the cost to be covered by federal funds. Okay, for HB 1462 relating to crisis services, Chair's recommendation is to pass this with Department of Health's proposed amendment of adding in appropriation language. So that there's a different paragraph saying basically that there shall be appropriated a blank amount to the Department of Health to implement this act. And a defective date of December 31, 2050, and technical non-substantive amendments need for clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, Chair's, on HB 1477 HD1, Chair's recommendation is to pass this with Department of Health's proposed amendment and change the defective date into an effective date of effective immediately upon passage. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, with that, we are adjourned.